Morning for me anyway. It's 6:33 a.m. and I'm on my 4th cup of coffee. And here we have Kerri. Kerri, thanks for letting me use your name. So much easier to talk. And thank you for sending in your video. So we'll take a look first at Kerri's static alignment to see how she's kind of holding herself, or not that she's really doing it, but this is how she is. And we'll see how she's walking with this structure that she is statically resting in. So, standouty things. I'm looking at her left knee. I don't know why. I'm just drawn all the way, right away towards her left knee. It kind of looks like her tibia is in an awkward spot relative to her femur. I'm not sure if I can articulate that further right now, but there's something about her left knee. It also looks like the quad muscles across her kneecap are a little more pulled up, which to me, it strikes me as a bit more of an extended knee. So we'll see what that looks like. Looking at her pelvis, it's always a nice place to look to see if there's a sense of being shifted more towards one foot. Like if you look at the midline of her pelvis, is it more over top of one of her feet? And I want to guess that she's a bit more over her left foot. We'll see if that's true. Again, I'm just speculating. I'm always amazed at how differently everybody sees things. Not to say one person is right or wrong, but I'm always mind boggled by how I am completely different in what I see compared to many people. So take it all with a grain of salt. I'm looking at her shoulders now, and in particular, I mean, I can't tell if it's because her fingers are more curled on her right arm than her left arm, but her right arm doesn't come down as low on her legs as her left arm does. I do have the sense that she might be a little more laterally flexed to her left through her spine, or that her shoulder girdle is doing something different there. Her clavicles are kind of interesting. It almost kind of looks like that right clavicle. It's more prominent. It looks as if I'm just feeling my own clavicles and what they're doing. Yeah, the more prominence on the right side. I'm going to suspect she might be a little more anteriorly tilted with her clavicle and scapula complex, maybe a bit more protracted. The left one, it's not very defined. So to me, I'm just playing with my own clavicle and seeing if I can feel what's happening there. It kind of looks like a bit more of an elevated, retracted scapula on the left. We'll see from the back view. That's very different looking. And it looks like it could be pulling a bit of a rotation into her. Ooh, her ribs look very different, hey? You see more prominence on the left side of the rib cage. Not sure what that means yet. But a bit more of a flare, like there's more rib cage there that's sticking out. That does that happen when the rib cage rotates to the left? Same side rib flare as rotation. We'll have to look at that potential rotation to the left with her rib cage, and the position of her shoulder girdle also looks like it's pulled towards her left. So we'll see. And her right big toe looks to be in a little bit more of an abduction. So abduction meaning away from midline, not away from the midline of her foot, but the midline of her body. So you could think of it like a buniony sort of angle to that big toe on the right. That's kind of interesting. Both arches appear to be lifted, so she's not collapsing down, but that doesn't mean anything. We need a bigger picture. Okay, so let's take a look at back view because I'm curious about those scaps. Yeah, it does It does look like her shoulder girdle is rotating to the left, like that left scapula is sticking back farther, more of an anterior tilt looking. Well, that's interesting because I was thinking it was more the right side that looks anterior tilted based on her clavicles. But it actually, or maybe that's an elevation, not too sure. But see this little, I wish I had a pointer in my images, but this little sticky outy wingy bit, the angle of the scapula on the left, it looks to be more away from her rib cage, meaning, or maybe not meaning, but kind of indicating to me a bit of an anterior tilt. So the bottom of her scapula lifted away from the rib cage, whereas her right one's a bit more flush, but it does look more protracted on the right and more retracted on the left, but a weird kind of retraction where it's a bit of a retraction with a elevation. Yeah. Just looking at if the clavicle matches with that. So that clavicle on the left is more pushed posteriorly as well as the scapula more pushed posteriorly. So it's, yeah, it does kind of, do you get the sense that she's squeezing back her left shoulder blade? Your left arm's a bit more externally rotated. So that kind of all tracks together, a scapula more retracted with an arm externally rotated. So we could expect in her gait cycle that might show up as something. We'll have to see what it shows up as. It might be that that's an arm that swings forward more easily, but it also kind of looks like it's held kind of stiffly, so it might not swing much at all. Feet in the back view are fun to look at. She's more, it's interesting about just the difference in her Achilles, the quality of her two Achilles. Very thick looking and undefined on the left, and very thin and defined looking on the right. Foot is a bit more turned out on the right, and a bit more almost looking like an internal rotation of her tibia on the left, as you can see that big toe side of her foot sticking out on the inside of her left foot, but on the outside of her right foot, like 4 toes are sticking out there. Just the qualities of her 2 heels look super different though. Like that left one a bit more boxy shaped, and then the right one a bit more thin and rounded shaped. I have no idea what that means, but in her list of things that her body complains about, she mentioned a vague note about her left foot feeling weird. So not sure. I am really drawn to her left tibia though. It looks internally rotated, and it also looks like her tibia sits more on the outside of her femur on the left, and her femur on the left a little bit more on the inside of her tibia. I'm not sure which is the case. If you look at her glutes, sorry, Kerri, zooming on your butt, but the left glute does look a bit more full and developed laterally than the right glute. So more development in that area could be due to muscles that are becoming habitually loaded on one side compared to the other. From a back view, I'm not really sure if I'm clear on if she prefers standing on one foot or the other. The left tibia being lateral to the femur, it's doing a number on my head. It really is. I gotta stop looking at that for a sec. And I'm suspecting that this right knee internal rotation, or sorry, external rotation, the tibia being externally rotated on the right, we're gonna see, it kind of looks like her right leg, her femur is internally rotated. I'm just thinking about what would make a calcaneus and an ankle look so thick on one side and so thin on the other side. And there's some kind of habitual pattern of movement that would be leading to that, I'm going to guess. Wolff's law, forces you put on a thing causes that thing to adapt to the forces. And I'm suspecting her right knee is going to be a bit more flexed and her left knee a bit more extended based on the posture of her feet there. She mentions that she has some left SI joint issues and some lumbar spine discomfort after long hikes of more than an hour. And she does look quite extended in her lumbars there, doesn't she? It's almost like all the energy of her body, that's a woohoo thing to say, but it looks like all of her energy is getting sucked up into her shoulders. Maybe a bit of lack of support in the lumbars, but lots of shoulder girdle power. Side views. Whoops, see, it's not her. What can we see from a side view? We can see that shoulder girdle rotated to the left here. If you look at how much of her arm, or rather how much of her rib cage you can see in front of her arm from a left side view versus the right side view. It looks like her rib cage is pointing more to the left. There's more of a rib cage you can see from the left side. And this right shoulder does look a bit more forward. You look at where her shoulder is relative to her ear, it looks a bit more forward on the right, and the left looks a bit more back. And that left arm is more externally rotated. Right arm more internally rotated. Just trying to find the front view again. There it is. Left shoulder a little lower. Does that show up in the back? Not really. So we might be seeing a bit of a lateral flexion in her spine to the left, because from the front view, it looks like her right shoulder's higher. But then when you go to a back view, it looks like her right shoulder's lower. So we might be seeing that her left scapula is actually elevated, but her spine's laterally flexing to the left. So that always makes it a little bit of a mind fuck. We'll have to see what's actually going on in motion. So I'm super curious about her lower legs. That difference between her 2 feet is kind of, grabbing me. So let's take a look, see at her gait video. Sip coffee. Remember, this is my first time watching this. I have no idea what's going to happen. So I'm probably going to be rather fumbly and inarticulate as I try to say what I'm seeing. First time through, let's watch at real speed. Oh, there's that left lateral flexion. You see that left lateral flexion, right, left rotation of her spine. You see that left. We call that a type 2 spine when we have a lateral flexion and rotation of the spine going in the same direction, both left. And that shows up in several gait cycle phases. And there's that left lateral flexion. If we think about her SI joint complaints on the left, this could have something to do with it. Thanks, Kerri. Let's watch that again. Oops. Here we go. Looking at her feet now on the second time through. She does have this thing where she rotates in her left leg. Trying to gauge if it looks like more of her weight wants to go through her right leg or her left leg. I'm kind of not entirely clear on that. One more time. Real speed. I have the sense that her right ankle doesn't dorsiflex. Watch it from the back view. Her heel never really stays fully on the ground. So she might not really be loading through her Achilles tendon, which may be part of why we're seeing such a difference in the structure of her Achilles. Yeah, that left tibia internal rotation is getting me. I think she's dumping a little bit more weight into her left leg. We'll have to watch this slow-mo. So let's do that. Phase by phase. We'll put her through a few steps. So let's go 1 step, 2 step, right heel strike. I'm going to try to keep this short because I only have 10 minutes. Let's see what we can do in 10 minutes. All right, right heel strike. Not too shabby looking. One thing I'm drawn to, however, is the elevation in her shoulder girdle. Both of those scaps look a little bit elevated to her ears, almost like she's about to step off of a high diving board, like, not sure if that's true, but it feels like that. I remember when I had some right hip problems, and whenever I stepped off the curb, it feels like I was doing that. I didn't know where my foot was going to land, so I had to brace myself. It was the weirdest feeling, just not knowing where your leg actually is. In terms of heel strike mechanics, where she's coming from is mid stance and early swing. And we should see when she swings her leg through, her pelvis shifts to her right foot. It does not. It does a little bit of a drop on the right. And a drop on the right is associated with an abduction of the hip. And we actually don't want an abduction. We want adduction of her right hip in a heel strike. She looks to be landing more or less on the lateral aspect of her calcaneus. Way to go. And she does look to have 2 points of contact, first and fifth metatarsals on her back foot. So that's pretty good. Okay, let's see what's happening in her pronation on the right foot. So we're going to pinpoint the moment when it looks like all her toes have finally hit the floor. And I'm going to say there. So she is losing first and fifth metatarsal on the back foot. So the supination, not ideal, but whose supination is really ideal, let's be honest. And what's kind of nice is that as her toes land on the ground, we are seeing that couple with a hike on the right side of her pelvis, which is great. Hiking in the pelvis, giving us an adduction in her right hip. She still looks to be quite elevated in both of her scaps, however. That's not changed much yet. Interestingly, if we just speak about bilaterally the spine, when we're in a phase when one foot is pronating, the effect up into the spine should be we see some extension in the lumbar and thoracics. An extension in the thoracic spine, what should that do with the scaps? Elevate them or depress, i.e., when the spine extends, should we see the scaps move up to the ears or slide down to the feet? And if you try it, extend your spine, you should feel your scapulae both descending. They should depress quite effortlessly. However, hers have stayed elevated throughout 2 phases so far. Elevated here, elevated here. So there might actually be something with her thoracic spine or lumbar spine, something central that we need to consider. Anyway, let's move along after a little coffee break. So mid stance. So she does further hike into mid stance. Typical human being behavior. So I can't give her a penalty for that. Although ideally, you'd like to see a level pelvis right here. So it's not too bad. However, we still have that elevated shoulder girdle situation with a bit of a head that looks to be forward and down, and it's been that way throughout all 3 phases here so far we've looked at. Now, does the quality of her pronation, it's nice that we have a video with a bit of clarity in her feet. Does it look like that calcaneus is everting, meaning more weight towards the inside? I don't know. I don't think it's everting. So there's dubious pronation quality. There is a bit of that space under her heel. So I'm not sure she's really moving cleanly through her talocrural joint into dorsiflexion. Okay, not too much to say yet here. I have a feeling we'll get into a little bit more interesting stuff on her left leg. So let's find that heel strike on the left, right there. All right. So she looks to be, is she shifting her pelvis to her left? A little bit compared to when she was going. Yeah, she's definitely, look at her pelvis here when she swings her right leg through, pelvis drops on the right, not too much of a shift. Do you see how it looks like she's still hanging out here? She swings her left leg through. There is this sense of moving to the left. So this left SI joint stuff, and that we saw increased development of her left glute. Could it be she is more left? What's the word I'm looking for? Leftward. She is more leftward. She puts more her weight into the left side of her body, and that creates a situation for the left glutes to be loaded more consistently, more pressure into the left leg more consistently, potentially more compression. The left SI joint. If you go back to the left heel strike, or sorry, right heel strike for a moment, and we can see there's this left hike in the pelvis, which I formerly called a right drop, but you can't have a hike without a drop on the other end. This left hike is how we would see the SI joint compress in the frontal plane. And if she's not ever getting out of that, she gets a little hike on the right here. However, as she's dropping the left side of the pelvis, she's lost the foot contact with the floor. So while the pelvis is dropping, it's not connected to a leg. It's not connected potentially to a hip that can also decompress and a hip that can extend, because she's missing the supination in the foot, and that's going to change the mechanics up at the hip. For more information on how, take an anatomy motion course with Kerri Ward. Back to left heel strike. So she does seem to be more level here with her pelvis. And we're starting to see right about here that left lateral flexion in the spine begin to take place. You can see it happening in the lumbars. Interestingly, what's up with your left shoulder, Kerri? Is there anything? Your left shoulder. reason I ask this is we start to see her go into a left lateral flexion of the spine. By the way, left heel strike, we'd want to see the spine doing a right lateral flexion, not a left lateral flexion. So the timing of how her spine is flexing to the left is a little premature. Not sure why. But with a left lateral flexion of the spine, one would, oh, it's terrible, terrible drawing. So here's the left lateral flexion of the spine. One would expect to see an arm that abducts, meaning that it swings away from the body. But we're not seeing that here. It actually looks like her left arm is hugging more tightly towards her body, or of an adducted glenohumeral joint on, that's supposed to be an L on the left. So that makes me wonder, why is that arm staying snug to her side when it ought to be hanging freely and swinging away? And why is her spine side bending the wrong direction? Something's up there. So we'll keep that in the back of our minds. And let's watch her go into a suspension phase, i.e. pronation on the left foot. She's quite a bit more crossed over, so it's tough to see. I actually would like to, let's keep going with this stride, just a bit consistent. I was going to say I'd like to watch her leg a little bit more. This is the side where her tibia does some interesting things. Yeah, do you see how right there? So watch the rotation outwards to inwards of her left tibia. Here we have a bit of an external rotation, which is totally normal. You definitely want an externally rotated tibia when you swing through. It's just a matter of, is it appropriately proportioned? So we still have an external rotation tibia, external rotation, external rotation. Starts to turn in. And it looks like a bit of an internally rotated tibia when it lands on the ground. What that will do is it's going to make it kind of weird to bend your knee when your tibia is rotated in like that. She did mention some left foot weirdness, so I wonder if that's part of the mechanics of that. Does it look like her knee bends as happily? This side does it as well, a bit of a rotation in as she lands on the ground, swoops in. That knee, I get the sense it's just a bit better of a bend. Yeah, I don't know what it is about that knee bend on the left, but it looks a little bit more jarring. This one looks a bit more smooth and like it bends, and this one looks a bit like it's actually happening there. Yeah, I'm not sure what's happening there, but it's not as kosher. I don't know. Okay, anyway, let's look at what's happening up at her pelvis. So we have left foot pronating. Can't really see the toes. I don't know exactly when her pronation, we can say it's actually there perfectly, but I'm going to say right there, right there. So we can see this lateral flexion of the spine here. Now, this is where we do want a lateral flexion in the spine. It always mind boggles me how many times we see the spine laterally flex from right to left within the same footstep. So when we have a pelvis hike on the left here, which we ought to when the foot is pronating, that's where we'd see this left lateral flexion in the spine. And as I mentioned, this lateral flexion in the spine should show us an arm that is also not like it's swinging out to the side, but there should be some space between her arm and her body here. We can't see any. Whereas we can here, her right arm should be the one that's stuck closer to her side, but in this case, we have her left one. So that's really interesting that she has a left arm that's adducted, externally rotated. And it looks like the scapula is retracted, possibly elevated, and anteriorly tilting. I'm just going to do that with my arm right now. Adduct the arm, externally rotate it, retract it, elevate it. Oh my God. Does your neck feel funny? Oh, she said she has some left C-spine clickiness. Okay. No pain, just clickiness. Interesting. So I want to ask about history on this left arm. Why is it holding itself like that? Did you have any issues with it being like dislocated or yanked, or you fell on it, foosh, something? And her spine seems quite rotated to the left. Let's move her along into, ooh. So there's a pretty noticeable difference between her left and right mid-stance phase. Look at the level of the hike in her pelvis on the left side. And if we back that up to her hike on the right side, quite a bit more flat on the right side. It's still hiking a little bit. Look at how her spine is more straight. Look at how this foot is less externally rotated. And here, more hike on the left, more lateral flexion of her spine to the left, more external rotation in that tibia on the right. So it seems like she is missing this, this part of the cycle. It's interesting because she's kind of a bit split. Body has a split personality where from here down, she's pronating, meaning that she's getting the external rotation in the knee and possibly a bit better quality pronation of the foot. Not too sure about that statement though. I have to see a bit of a closer foot motion assessment. But from the pelvis up, she's missing pronation. So full body pronation includes a hike on the pelvis and a lateral flexion of the spine to the right. We'd also want to see a right rotation of her spine. So that type 2 spine. So she's missing the spine to match her knee, if that makes sense. Let's take a quick look at the chart. As per usual, I get sucked in and can't stop. But let's take a look at some front view just quickly before we wrap it up. So I'm going to put her into a right heel strike. Right there. I'm just going to back it up a little bit so we get a more pure gait that she hasn't just turned around from. So right heel strike. There. This tibia just looks too internally rotated. Oh, it's so wonky looking. It's pretty interesting looking this angle here where it looks like her femur is externally rotating, but her tibia is not. It's looking more internal, bit of a weird twisty knee thing. I wonder if you have any history on this knee? Some kind of ligament, something or other, ACL, PCL, probably not ACL. You never know. Anyway, pronation. When did those toesies on the right land on the floor? So I think when I was in the back view, I had her more like stopped there. But if you actually look at how her toes aren't yet on the ground, which is what we need for a pronation, doesn't really look like she fully has her foot on the ground until there. What we can see here is that both of her hips quite creased, quite flexed still, getting into mid stance, but she's kind of in a transition between mid stance and suspension phase or pronation. You'd want her to actually be getting her hips to, or her pelvis to posterior tilt, but she's still in an anterior tilt or both hips are flexed. This might be the spine, lumbar spine stiffness. She's never able to posterior tilt her pelvis. She won't be able to decompress her lumbar spine with flexion in the lumbar spine. And this knee. So you can see when she goes into her pronation on the left foot, her toes land on the ground a lot faster. But do you see the angle of her tibia? It's just pointing inwards. So this knee doesn't look like it wants to flex. Look at the quality of her knee here when it's supposed to be at its most bent versus the quality of her knee here on the right. It looks a bit more soft. And a knee that's more externally rotated, like her right one, which we saw here when it swings through. Do you see that external rotation through her tibia? That unlocks the knee so that it can bend comfortably. When her left knee swings through there, or rather when it lands there, it doesn't look like it doesn't bend. It looks a bit more rigid there, but we do see some squishiness up in her hip area where the pelvis hikes. So if you can't get that shock absorption and bounciness from your knee or your ankle, might get a bit more to that pelvis hiking. But remember, the pelvis hiking will contribute to a bit of an SI joint compression, possibly. So a story question is there history here? Can you flex and externally rotate? Oops. Flex and externally rotate left knee. Did anything happen to this knee that's locking it in extension? Question number one. Question number two, can you actually posterior tilt your pelvis? Oops. Pelvis. The reason I'm asking that is because it looks like your lumbar spine stays extended and your hips stay flexed all throughout your cycle. Neither hip really extends well, and you extend either of your hips. So like in a half kneeling hip flex or stretch kind of thing. How does that feel for you? And I'm very curious about your left shoulder. Why doesn't it abduct? Why is it holding so tightly to your body? So a nice little investigation of your left shoulder, left knee, and your pelvis and the sagittal plane. That's where I might like to begin further assessments. So Kerri, thank you. Could you write in the comments of this video some stuff that tracks with you, stuff that is relevant in your history? You can say any of your thoughts, really. Yeah, just some feedback from you would be awesome. And anyone else tuning in and watching this, what do you see? I'd love to hear your observations. Again, when I hear other people's perspectives about what they're seeing in someone's gait, it's so nice. Um, because like I said in the beginning of this video, I am always questioning what I'm seeing. Like, is that there or is that just me? Am I making shit up in my brain and projecting it, or is that really there? Isn't that the question of life? Is that really happening, or am I just projecting this? Uh, Not to get too existential at 7 a.m. But we'll leave it there for now. Thanks for tuning in. And stay tuned for another gait video sometime soon.